It's so sunny.
Turn left onto East Flint Street.
Always set it for 9:15 a.m. But as I said, I will get started between 9:30, depending on.
In 600 feet, at the traffic circle, take the first exit onto Orion Road.
Depending on how my day goes. My morning. Or someone was out digging my house, my yard out, my addition. Good morning. Why this ain't on the charger? Oh, Jesus. Pay attention to the road, honey. Pay attention to the road.
In a quarter mile, at the traffic circle, take the second exit onto Stony Creek Road.
It is hot today. Not super hot, but it's hot. Thank God. Stony Creek. What? Oh, right here. Oh, yeah, because if I would have been coming from home, I got to roll this window down. I hope it's not too loud. It is hot. So, yeah, I sit up doing these videos, recording these videos, and sometimes I watch them back. And there's all types of fatness under here. So, been working on my weight, been losing weight. So, maybe this will go away with it. So, being that I got it, I started paying attention to different people. See if the little neck fat is kind of half. Anyway, so I am on my way to do the health risk assessments. And I really don't have anything to talk about today. Everything's going well. My schedule is good and filled. I'm going still in Lapeer County. I don't pass any restaurants because I just go down dirt roads. And so now I'm not really eating. I'm not eating in the morning. I do have this.
In half a mile, turn right onto Lake George Road, Stony Creek Road.
This vitamin C drink. I got to get another jacket to get my other more letters added to this. So I guess I'll have to do 2 rows because I don't know where they all will fit.
Turn right onto Lake George Road, Stony Creek Road.
But hold on, let me close that up. Sorry about that. So now that I'm in Lapeer,
Continue on Lake George Road for half a mile.
my visits are. So I started in Detroit, and then my second, like I changed my, I told
In a
you
quarter
guys,
mile, turn left onto Stony Creek Road.
I told you guys you can change your like your counties where you want to work. So I started out in Detroit, and then I was going
Turn left onto Stony Creek
to
Road.
Genesee County. So when I was in Detroit, my visits were like 40, about 40,
Continue on Stony Creek Road
about
for
40
2 miles.
minutes or more out. Some was like an hour. That would be the longest commute that way, Metro Detroit area. And then then I went to Flint. I changed my county to Flint, and then those visits were like 50 minutes. Genesee County, I mean, those visits were like 50 minutes, and the longest commute was like an hour, 15 minutes. But like I said, the good thing about it is all your visits would be in one area. So your first home would be the furthest you would travel, and then all your other visits would be in that same area, like 2, 3, 4, no more than 10 minutes away. I don't know, 55. He just posted, ready to pull somebody over. Thank God I wasn't even doing 55, and that was the speed limit. So now I'm in Lapeer County, and my visits are like 35 minutes from my home so far, which is good. I'm happy about that. I'm really happy about that. So no more rushing home, rushing to Aiden's school to get him out. No more threats of, if I'm 1 minute late, Aiden will be kicked out
In
of
half a
the after
mile,
school
turn left
program.
onto South Rochester Road.
All that BS. So I'm excited. So once you get with the company, you can you can request different counties. Just because you're in one county don't mean you have to stay in that county.
Turn left onto South Rochester Road.
When you talk to the recruiter, you just let him know, hey, I'm willing, like in my area, I said I'm willing to go to Oakland County, Wayne County, Lapeer County, Genesee County, Macomb. I said Macomb, but then once I thought about it and it came up and they say,
Continue on South Rochester
we have
Road for 2
openings
miles.
in Macomb, I thought about it, like I don't ever want to go to Macomb, because Macomb traffic is just horrible. It's just horrible down in 59. I just can't. I can't do that traffic. So, oh, no day. So I opted out of Macomb, and I just let them know. I know I said that, but so you don't have to, just because you say something don't mean you have to stick with it. You can always change it up. So the only thing is, if you change it up, say now I'm in, we're in April. If I make the changes for April, and then my schedule would change, like I might have a full schedule right now, but being that I made some changes, then my schedule may not be full until the following week. So the week that you make the changes, you may not have a full schedule. So it's kind of good to have the changes start the following month. Like I think I'm going to add a day and Friday back on. And but I wouldn't start it. I don't know. Sometimes it's weird. Sometimes they could just add the Friday. But from my experience, just don't touch April. Just start May. Because it's always something that goes wrong with my schedule when I make the change within that
In
month.
half a mile, turn right onto East Romeo Road.
So you would make the change for the following month. So remember, you don't have to stick with whatever the counties that you originally said, or you can go to a county and find out, hey, I don't like this county.
At the light, turn right onto East Romeo Road.
And they don't get upset with you. I'm telling you, this job is like having your own business, and the staff is there to support you. So they're not getting upset
Continue
with
for 3 miles.
or anything, because at the end of the day, you're making them money. So that's why I say some big companies don't respect the fact or value you as a employee, and don't understand that if you weren't there, you guys won't be making this money that you're making. You need staff. You need me. You guys, the big employers, try to act like they don't need you. Well, this is a big company too, but it's just different. I found, and I've worked for a lot of, I don't know how long I've been offline. That is so irritating. I've just been talking and talking and talking and talking, and I don't know how long I've been offline. So, because I don't know how long I've been offline, I guess I'll just pick a place to start back up. Freak. I wish I get a beep or something to let me know when I'm offline.
In a quarter mile,
Anyway.
turn left onto Michigan 53 North Van Dyke Road.
Y'all got my phone number. Y'all gonna have to start calling me or something. 248-842-2662. When I go offline, y'all have to call me, and then I'll know. I'll look at the phone and I'll know I'm offline.
At the light, turn left onto Michigan 53 North Van Dyke Road.
Y'all have to start letting me know, hey, you're offline. Okay? Because I'm not looking at the phone. I'm driving. So you guys, please, next time I go offline, just call me. Then I can look at the phone and see, oh, I'm offline, or whatever the case. Or text me something. Just let me know. So I don't know where I left off at. So I'll just start. I got 11 minutes before I get to my first destination. So I'll just go back to the whole thing. Is none of this is scripted. So I don't know. So anyway, so I was saying that I've worked many jobs in my career, especially before getting in the nursing field. Probably worked about 40, 50 jobs, if not more. I don't know. And I've never worked for a company like this. So this company makes you feel like this is your own business. Granted, you left off at when you were working. Okay. Oh, I forgot I can't pick the phone up.
Continue on Michigan 53 North for 8 miles.
Okay, hold on. 8 miles. Let me see where I left off at, because I really don't want to waste people's time. Up at. So yeah, I worked plenty of jobs. And I've never worked for a company like this before. I've never worked for a company like this before, that value their employees. Like, let me describe what I mean. I feel like this is my own company, and the staff, the employer, is supporting me. That's how I actually feel. So it's a 1099 job, and so you get no benefits. So you keep your job with the benefits, or they have private insurance. You can go to Marketplace or reach out to one of those people, those companies that offer insurance. So this company supports you. So just because, like I said, I was working in one county. When I started, I was working in Wayne County. Then I said I want to go to Genesee County. Then I said I want to go to Lapeer County. Then I said, oh wait, Lapeer seemed like it ain't working out. I might need to go back to Genesee County. So I said that to say that just because you initially say that or agree to work in one county doesn't mean that you have to stay in that county. So they're not going to be calling you, emailing you, saying, hey, why you keep switching counties? Like, what's going on? They're there to support you. Okay, Angela, if you don't want to work in Wayne, we'll move you to Genesee. If you want to work in Lapeer, let's see what we can do. They're there to support you. They're not there to discipline you for wanting your life to be smoother, wanting your commute to be smoother, wanting your visits to be smoother, or whatever the case. They're there to support you. And that's what I like about this company. So don't think once you get with this company that you have to stick to the county that you originally said that you want to work. They don't care. They want you to be happy. And like I said, everybody's making money. So the recruiter's making money off you, and which you know, the company's making money off you, you know. If you guys come on board, I'm making money. Like, they give a generous bonus, referral bonus. And why do they give a generous referral bonus? Because they know that you're making the money. Like, that's why I was saying I don't like the hospitals. I don't like working for people or companies who look at you like a revolving door. Like, you're like, honey, we'll fire you tomorrow. Smile on your face today and fire you tomorrow. I don't like that. They don't understand that the reason your company is making money is because we as the staff are here to make you money. If we weren't here, you wouldn't be making the money that you make. If you weren't fully staffed, the families would complain, and word will get around, and people will stop coming to your company, and eventually you'll have to close. Respect the fact that I'm making you money. We are making you money, the employees. So this company understands, hey, you're making us a lot of money. We're making millions of dollars off you guys. So no, we're not making that much. But because they appreciate us putting money in their pocket, they're going to treat you good. Like I said, you're not going to work at a hospital and like find out that you want to take a trip next week. You got a whole full schedule. Here it is Friday. Your friends or family like, hey, Remember, we were talking about the trip. We're going to do it last minute. We're leaving Monday. We're coming back next Sunday. Can you call your job and say, hey, or request it off? No. Most jobs say a month. So you need a month notice. Put your request in and ridiculously. And it doesn't guarantee that you're going to get it off. So what does this company say? Nothing. You call them on a Friday, say, hey, I need to clear my schedule for next week. And they'll say, why, what's going on? You'll say, personal. And they'll say, okay. Or you can tell them, I'm going on a trip. Okay, whatever the case is. They're not tripping. They're not going to be emailing you like, hey, you requested a day off and you only gave us a 2-day notice. No, they're going to say, okay, hope everything's well, gets well, or enjoy your vacation, whatever they want to say. But they're here to support you. So they're going to, what else are they going to do? They're going to give you $40 a day, work shift. Most companies, they don't even want to pay you for your little break, your lunch break, or they force you to take the lunch break, or they, if they paying for it, we got to take it. It's just a lot of stuff with it. This company like, hey, here's $40, get some gas or some food on us, because we appreciate you out there working hard. Oh, you don't have reliable transportation? That's okay. We'll give you a rental car. Go to your nearest rental company and get a rental car on us. You'll never see a bill. If you work 3 consecutive days in a row, we'll give you'll go get your rental car and you just renew it once a month. You're not working 3 consecutive days in a row, that's okay. Just go renew it every week. Here's the rental car. Oh, you don't have transportation to get to the rental company to get a rental car? That's okay. Call an Uber or a Lyft or whatever, and we'll reimburse you. We'll pay for that. Oh, you don't want a rental car? You just want to get an Uber to take you to work? Okay. Well, we'll reimburse you for the Uber or the Lyft for taking you to your visits. I don't know. I love this company. And like I said, I'll be doing this until I start my own practice, because nowhere else. I'm not talking about contract company. Yeah, you can make a lot of money doing contracts and working, 3 12-hour shifts or 40 hours a week or whatever. I'm not trying to work 12-hour shifts. I'm not trying to do 40 hours a week. Scheduled, I'll do a per patient, and if that averages out to be 40 patients, I'm getting paid per patient, then that's different. But I'm not doing that anymore. So yeah, if you work a job that pays contract money, then yeah, you'll make good money. You'll make this kind of money or maybe more. But with this company, I make enough money doing health risk assessments. I make enough money where I don't feel like I would make this in any other field. I don't think I make this kind of. I know I wouldn't make this kind of money in clinical practice. I wouldn't make this kind of money at the hospital. First of all, I don't have the years, and hospitals and other companies, they want to go off of years of experience. So I don't have those years of experience. So if you want to make great money, I'm talking about great money without the years of experience, straight out of school, health risk assessments is where you want to be. Where you want to be. And what I tell you guys, even if you're about to graduate and you're scheduled to take your exam, most companies will hire you. Start the hiring process, because credentialing takes what? Credentialing takes 4 weeks to 3 months. Not with this company, but other companies. That's why I say, don't, when you find a job, don't put your 2 weeks or whatever in, because it's going to take a few weeks before you to start the job. And it's the same thing when you quit a job and looking for another job. Each nurse practitioner job has to go through their credentialing process. So therefore, you'll have to wait the same, the 4 to some companies 6 months. I don't know. It's just crazy, the credentialing process. And that's when they get you credential with all the insurance companies and everything, and just verify who you are and make sure your license checked out and all this stuff. Okay, so but this is it. So if anybody's interested, reach out, or somebody that is interested. My recruiter, he doesn't play any games. He gets right to it, and he'll have you signing up, filling out paperwork, filling out everything, start the onboarding process in like the same week. It's quick. He don't play around. So my experience, and you guys know from day one, I haven't steered you guys wrong. I make all the mistakes, so you guys don't have to make the mistakes. So you guys don't have to come out of school and stay at the job that you hate, because like I did in the beginning when I became an LPN. I was working this job in dietary, and I stayed at this job because I'm like, oh my God.
In half a mile, turn right.
At least if I stay here, I'll get the experience I need. I mean, I'm guaranteed a job. So, and then I can get
turn
my
right,
1 year.
Then turn right.
I can get my 1 year experience. Where am I turning right at? Oh.
Turn right, then your destination will be on the right.
Yeah.
Head north on Michigan 53 North, then turn right.
So I'm like, at least I can get, I know I'm guaranteed a job if I stay here. Well, you don't have to stay at a job that you don't have to take a job. So just so you can start working right away. You can start working with this company right away. Anyway, so I made it to my first destination. Let me drink my vitamin C. It's my breakfast. Then I'll see if you guys left any comments real quick before I get out. He's standing at the door. He is just standing at the door. Sir. Don't stand at the door, sir. I'm coming. But I have to get my things. Close your door before an animal run in. Because I have to get my sanitizer wipe to wipe the stuff down. And then I have to see if this guy has any labs that I have to do. But you guys, I don't see any comments, so I don't think you guys left any comments. Anything in the chat? Nope. So I have to look in here to see if this person, always check your notes. So in-person visit at member's home will be available if running late. Member has a pet. And yeah, so I have to take this in there because they have a you have to do a peripheral artery exam, and that's what this was for. So I'll put that in there. And come to find out, that's just a $5. You get $5 extra for doing that. I thought it was more, but it's not. So, all right. Actually, if you guys want to stay, I'll do a favor. I'll take you guys in there. I'll put you in my pocket and take you guys on a visit. So I won't share any names or addresses or anything and violate HIPAA. So you guys don't know who house I'm going to, the name of the person or the address. So I'll keep you in my pocket. Keep you in my pocket unless you hear the visit. All right. Okay, roll the windows down some so it's not so hot when I get back in here. And let's start the visit. Bye-bye. You guys go in my pocket. Oh, God, I got my bag. Oh, put my face mask on. What the heck did I do with the face mask? Put this one on. I just wear it because I go to different people's homes. I don't want to be responsible for anyone being sick. Alright. Have you? Alright, put it up here. Visit. I'm not tired off. I live in Lake Orion. This might be some orange. Orange healthy. What's your race?
White.
White. Okay. American. English. Married, single, widow, divorced. Employed, unemployed, retired, disabled.
Disabled.
Okay. I don't have a doctor here. Do you have a primary care provider?
Yeah, I'm surprised they don't have that in there.
No. You've seen him within the last 12 months?
Oh, yeah.
Have an appointment coming up?
No.
No.
John Kills.
Yep. But they didn't have him listed, so.
No, and then here next week I go see my heart doctor.
Okay. All right. You taking medication?
Yep, right there, all
All
those.
right. Is this your first visit with us?
Yeah, with
Okay.
you guys.
Okay.
And that's my cholesterol. I take 1 aspirin a day. And that's my water pill. I only take half of one of those a day. What is this? That's just muscle mass. I take
Okay.
that one. I don't have one pill. I don't have no one pill. And I take that when I need it. And then that's just my. I don't have my one pill there. I can see where it is. I don't have my Batoka out there. Yeah, once a day.
You have some edema going on?
Why?
You have some swelling?
Oh, yeah, well, I had congestive heart failure.
Okay.
Since I had that, I had surgery here a year or two ago. They did a picture on me. Huh. That ain't no good. Oh, here's my particular. Then I just
Pacemaker.
the sanctity sucks in.
Uh-huh.
Congested my heart and stripped off.
Oh, okay.
I went to Cleveland Clinic.
Uh-huh.
I was down there for 2.5 weeks.
So,
And then they fixed my AFib while I was down there too. I don't take no heart pills, no blood thinners. Tell you what, it's a big hospital down there. They couldn't do the procedure here. I kept telling my heart doctor that I didn't feel right. There was something wrong.
did they do any valve replacement?
Nope.
No.
What they did an angioplastic over here in Genesis in Grand Blanc, and they found out that what was wrong with my heart. So they called down there, and I went down there for an interview. Well, they said that I was going to have to come back and forth for a bunch of tests. Michigan. They said that we'll just keep your water off and procedure.
Where'd you go?
Cleveland Clinic.
Oh, okay. company came out before?
I had,
How many cares come out ever? How many cares? No.
I had, Humanity Insurance before. I don't remember who come out.
Okay. There you go. Yeah, that took me 30 minutes to get here. There's 7 visitors.
That'll make a full day.
Yeah, 3 people at one home, so that's gonna be good.
Yeah. What's the farthest thing you can go?
Well, I let them know what counties I wanna work in, and then I'll go from there. So, like, I'm in Lapeer County now, so like my first visit with you would be the first I would have to go. And all my other visits are in the same vicinity. Why do you take not relaxer? Is it from
my
spasm?
back. I don't take it all the time. Just from my knees. Yeah, I had to do it like this. I have to give it
Beautiful, thank God. You deserve it. I hope it stays.
what they're doing to this road.
Oh.
They just got these rumble strips that they're doing.
Yeah.
Yeah. I don't know what they're doing. I know this.
You have asthma, COPD, emphysema. What do you got going on?
Gotta see if they do. Yeah. Do that one. That I have.
You can tell me.
I had surgery.
Uh-huh.
My whole cavity right up here flooded. And they went in and cleaned it out. I breathe 100% better since I did that.
Oh, that's so good.
Took him like an hour and a half to clean it out. He says it was like a jackhammer getting that stuff out of there.
Was it?
Yeah.
At least it's done.
I sleep a lot better. I'm supposed to have a sleep app machine, but I can't sleep with one of those. I turn my head and I bury my head in the pillow half the time. And it moves the mask, and anything they put on me don't stay in place. Because it moves. Yeah, so my mouth and then wakes me up and I can't get back to sleep. That's my face. It's real dry. You gotta see it right now how red it is. It gets real dry. And that just helps it. Because if I put anything else on it, it irritates it. It makes it worse.
Do you have allergies?
A little. Just some heart pill a long time ago.
For the fluticasone, the nasal spray, why do you take that one?
That, because I did that surgery just.
For sinuses?
Yeah. then I take some vitamins, but other than that.
What vitamins do you
Vitamin B12, vitamin D,
Vitamin D,
and vitamin C.
B, and C. Got it. Alright. Do you have any allergies to medication that you know of?
A long time ago, like some herb pill.
Okay.
I don't know.
You have chronic kidney disease?
Nope.
Have you been to the emergency department in the last 12 months?
I don't think so.
Okay. You ever feel lonely or isolated?
Not really.
No. Alright. You ever have to choose between food and medication? Yeah. You have transportation to get to the doctors and pharmacies? Yeah. You can dress and groom yourself, go to the shop for yourself. Okay.
Piece of flag.
You have a living will, medical power of attorney. Are you a do not resuscitate? Your heart stopped, you want them to pump you and bring you back? Yeah. Okay. Alright. Are you in pain right now?
Not really.
Good.
Just don't have no energy today.
No. Okay.
No.
In the past month, in the past year, 12 months, have you had any coughing, wheezing, shortness of breath? Yeah, which one? All of them?
Yeah, I was coughing a little bit this morning. I don't know why.
Is your cough worse in the morning?
Yeah.
Yeah. Do you produce sputum?
Yeah, once in a while.
How long has that been going on?
Oh, just off and on, not a lot.
Okay. You get short of breath when you're just sitting at rest? You get short of breath at mild exertion?
Sometimes.
Okay, okay. Have you been diagnosed with pulmonary fibrosis? Do you ever get a fever with your coughing and wheezing? Good. You ever smoke tobacco? Good. Alright. You get short of breath when you lay down at night? Good. When you're doing physical activities, do you have to stop, get too winded?
Once in a while.
Okay. Ever had a heart attack?
Nope.
Good. No stents. They didn't put a pacemaker or anything in there?
No, I had all that done and then after I had that procedure, my heart went into AFib twice.
Mm-hmm.
The first time they zapped it, second time my blood pressure went low, so they wouldn't zap it.
Okay.
But then they put me on some pills that went back, and I ain't never had no problem since.
Oh, that's
And I
good.
only took the pills.
You get pain in the back of your calves that go away when you rest, when you sit down. You get pain in your feet that goes away when you walk around or dangling off the side of the bed.
Once in a while.
When you relaxing, you get pain when you walk around. Yeah, okay. You get numbness in your feet?
Not really.
No. And when you get the pain in the feet, is it in both feet?
Sometimes.
Okay.
I'll be just sitting in like sharp pain. I don't know. Signs I'm getting old.
Uh-huh. Are you a diabetic?
Nope.
Okay. Ever had a stroke? Ever had a heart attack? Already asked that. Ever had a seizure?
No, they think I had a slight stroke before because my eye.
Mm-hmm.
I'm legally blind on this eye
Okay.
because they think blood clot went to and took the part of my eye out.
TIA? You get chest pains or pressure? No. you experience excessive bloating after eating?
And sometimes,
Yeah.
not all the time.
Okay. Do you have difficulties with erections? Have you accidentally leaked urine in the last 6 months? Good. Right? No. Yes. No. You said you get the numbness sometimes? Or no? Sometimes. Okay. Alright. Drink alcohol?
No more.
No. Ever been to an alcohol or drug treatment program?
Yep.
You have?
Years ago. Yep, years ago.
Which one? Drug or alcohol?
Alcohol.
Alcohol?
Haven't drank since 2011.
Congratulations.
I was out.
That's good.
Quit on my own.
Good. In the last 2 weeks, have you been depressed or suicidal? Good.
I guess he's bored.
Bored, yeah.
Not like everybody does.
Yeah.
I got stuff I shouldn't be doing. I shouldn't be bored. But some days I don't have the energy to do it.
Yeah. Do you have HIV?
No.
No. Okay. Ever had cancer? Good.
I know too many people that has me.
Yeah. How tall are you?
5'8",
How much do you weigh?
283. I lost
Yeah.
slightly, yeah, but it's been more active.
In the last 3 months, have you had a decrease in appetite or unexpected weight loss? No. You go out and about, right?
Oh, yeah. Yeah, I went over to my buddy's yesterday. He's got a small little farm.
Uh-huh.
Walked 6 acres of his fence and fixed it for him.
Oh, that was nice.
Yeah, but it was wet and muddy, so now my legs ache today.
Oh, good.
Just getting in that mud and that, but I got a pair of boots I wear.
Good.
Well, give me something to do.
Right. In the last 3 months, have you suffered any psychological stress or acute stress?
No.
All right. Good. Alrighty. Moving along. Any amputations? Good. Clubbing of the fingers. You have an autoimmune condition? You
That's all.
don't. Let me see your feet and your lower legs, please. Take your socks off for me. Got any swelling going on? Is that normal?
It looks like
It's normal, so I don't know really it. It doesn't. That's normal for you?
I don't know, that's what usually he.
Yeah, that's what I'm saying. Nothing.
Yeah. They were here a week when I went to my doctor a little bit.
Mm-hmm.
But they feel all right now.
Close your eyes for me. Do you feel that?
Yep.
You feel that?
Yep.
You feel that?
Yep.
You feel that?
Uh-huh.
Feel that? Feel that?
Remember that one put sensitive when you
Yeah.
get that across there and jump. I was like, wow.
Alright. Get a little smoke on paper. Maybe just drop me a clock. Write on a paper towel. Okay.
I'm not very good at it.
Okay. Just put the numbers on there. And then make it say 10 minutes after 12.
I don't remember how to do this. 1, 2, 3, 4, 5, 6,
10 minutes after 12.
Is that right?
Yep. Thank you. I'm going to tell you 3 words, and in 3 minutes, I'm going to ask you to tell me the 3 words. Okay? It's going to be tomato, light, oh, it's a nice light, and hamburger. Tomato light hamburger. In 3 minutes, we're going to, So now I'm going through your diagnosis, okay? Well, I think I put all these here. Yeah. I put all these here, so I don't have any questions about these. Okay, ask me questions so I can y'all so you're not just repeating the words.
Those are easy. They give me some hard work the last time.
Really?
I got 2 of them right. Yeah.
When I first started doing this, I could only remember 2. I would ask the members, what's the 3 words? And I'm like, I don't even remember all 3 of them.
How long have you been doing this?
I've been working with this company. When did I start with this company? I think February. Ended of January. In fact, ended of January. Oh, I love it. But I've worked for another company, doing the same thing. Since
Put a lot of miles on the car, don't you?
June of last year. Yeah. Well, they give you a car as well.
Oh, they give you the car to drive? Wow. It's a fancy car, don't they?
Yeah. Well, you go, to the rental company and pick the car out.
First class. Hey, what is that?
That is the Suburban. Yeah.
You must have a bunch of kids.
Nope. I like big cars.
The way they drive anymore, up and down this road and up and down 44.
Yeah,
They drive like idiots.
Yeah.
You get to see on the real driving side. You probably tossing them out every day.
I try not to, but I do.
It's easy.
Oh, what's the 3 words?
Pencil light hamburger.
Good job. Yeah, that's it.
we're at this light a couple weeks ago, me and my buddy, and there's this pickup behind us.
Mhm.
There's two people in front of me.
Mhm.
The pickup behind us went around all of us when light changed on the right.
What? If you ever have to get rid of your medication, if it expired, or if your doctor discontinued it, they want you to take it to our Armanda Pharmacy on Main Street, or Orchard View Pharmacy on 30 Mile Road in Washington. They just don't want us to flush it down. You flush it down the toilet or anything.
Top shelf right here.
Oh, that's good. Okay. Does pain medication take the pain away in your feet if you were to take pain medication?
I don't know, the pain in my feet ain't that bad, it just comes and goes.
Okay.
Oh, yeah.
So they want to know if you're interested in being tested for peripheral artery disease. That's what I asked you, if you have pain that goes away when you sit down. You said no, but they want to know if you want to be tested to see if you have it. No? Okay, it's optional.
Do it.
Yeah.
How hard is it to do?
It's not hard. You just have to lay on the couch, take your shoes and socks off, and then I'll have to put this device on your fingers and toes.
I may have been done before.
Have you?
Yeah, but I've never laid down to have it done.
No?
No.
Yeah.
Yeah, I've never had that.
Test is the blood flow. To see if there's any restrictions or anything, if the blood flowing.
My legs ache some days. I don't think I got good circulation, but I've had it done before, and they told me, and then I had a CT scan when I was down there in Cleveland. They told me I got good circulation. Or whatever. I did.
Sign here for me, and I'll get your vital signs, and that will conclude our visit. No. Temperature. Got one like that? 98.6. Good. 98.6. 95, normal, 9400. So 95 is good. Oh. Deep breath in and out. Normal. Let's see if you have a heart. Yep. Good. Long sounds good. Blood pressure 123 over 80. Good. 123 over 80. And your heart rate is 1. Good. No. 61. Got two heart associations. One says less than 120 over 60. The other one says when you get older, less than 140 over 80. So you're doing good. Heart rate, normal, 60 to 100. Yours is 61. That's good.
Close to that.
Is it? Well, good.
I get doing something, it goes up to 110 for a
Oh,
while.
God. Stand up
Yeah,
for
but
me?
you know what, I feel better after I do stuff.
Yeah. Get that heart going. You have orthostatic hypertension. When your blood pressure drops when you stand up. That worked yesterday?
Muscles in my leg.
No. Gotta get you some vitamin C. When I don't have any energy, I take it. I feel better. Over 72.
What's my heart rate then?
Let me see. Heart rate is 56.
My heart rate's low today. It's usually in 70s and 80s.
Really?
Maybe that's why I don't have no energy.
Well, long as it doesn't matter. It really doesn't matter what number it is, long as it's between 60 and 100.
I should go do something today, but I don't know if I got any.
You gotta get out. When you go out there in that sun, you'll instantly get energy.
My buddies had to go have some tests done because his dad died of cancer. He had a colonoscopy already, but they're doing some other kind of test and he had he drives semi over there.
Oh, wow.
So truck. So I help him out. Good.
Oh, that's fine.
They take it for disability.
Yeah.
That's worth it.
Yeah. Well, that's good. Well, thank you for allowing me in your home to complete this assessment. And you continue taking good care of yourself, okay? All right, get out there and get some of that sun to give you some energy.
Okay, Mom.
You can either sit out there in a chair. It's so nice.
You're probably jealous.
All right, you have to give it. All right, bye-bye. I will, thank you. Oh, no. All right, you too. All right, well, that concluded that visit. On to the next one. So, as you see, that was not bad. My next visit is 2 minutes away. So let me call her and let her know. All right, guys. I hope you enjoyed today's visit. And hopefully you were able to follow me along into one of the visits we had today. Alrighty then, have a good one. Until next Tuesday. Or look out for, I might just schedule a live. I probably will for Monday. Just I'll probably do live questions where you guys can call me and ask a question and I'll answer the question on live or something. I don't know. All right, bye.